Now I've got my freezing on for about 20 minutes. Like I said, we usually do an hour for most patients, but really it's so comfortable. And let's go back to what the Pixel Peel is. So if you hear Alma Hybrid, which is my baby, right? That's a full refractioning, like that's a full meal deal. But Alma is the company that makes this amazing machine. And so the beauty about the Pixel Peel is it is something that you can do, like I said, a light refresh, just getting some of the pigmentation off, just like a light treatment. So I always say to patients, the wound healing is going to be what is according to the wound that we're inducing, because this is how we get new tissue. So I'm not expecting to have a full-blown resurfacing from this. I really just want some of the fine lines and the wrinkles. And then with the Pixel Peel being a CO2, we use something called LAD, or laser assisted delivery, of whatever we put on the skin next. You get about up to 700% more absorption of the products. There's these little micro channels that the vamp is going to penetrate into. All right. So usually people will have goggles on. So if you're a laser technician or somebody else watching, you're supposed to have like protective glasses on. But I'm going to try and chat to you while she's doing it, just to let you know kind of how it feels. So Emma is selecting just CO2 for me, because she thinks I don't need any lift.
Do you want some, or you're okay with just the...
Let's just do CO2. Yeah.
Are you happy with the size?
So what she is showing me is she's showing me the power of the device and asking me, do I want more power or less power? And of course, we're not going to ask you that as a patient. So I would probably do a little bit lighter, just because I'm not with the hydroquinone, which is still a really good CO2 amount, so 20, right? And we're doing a density component, so we're doing really dense, kind of medium depth. And around the eye areas, you can go up to the 30, which is a kind of like a full resurfacing. There we go.
So I'm thinking we're gonna do 200, 200, and then 100 and 100.
Sure. Go for it.
3, 2, 1.
So it kind of feels like when you make bacon and it jumps on your skin. And remember, this is 20 minutes of breathing. So really not anything. The spots that are always a little bit more uncomfortable for patients, just going to close this eye just in case, is around the mouth, close to the nose, and then on the cheekbone component closer to the eye.
That's on this here. We're just sitting at 145.
And so it's a very quick treatment.
Last 10 seconds. 5, 4, 3, 2, 1.
Don't know if you guys can see it, but you can kind of see that little, looks almost like frosting on my face. So we're doing what's called an accumulative energy, the amount of energy delivered into the skin. So for a pixel peel, to give you an idea, it's usually, if we do a light pixel, it's between 600 and 800 pulses total. If we do the same technique, this painting technique, with a hybrid, right? So meaning your full resurfacing, then we're going to do 5,000 to 6,000 pulses. So you did now, how many pulses did you do?
It was 260.
So 260 pulses. So it would be 10 times that amount. And I would definitely not enjoy it if I only had 20 minutes of freezing on my face. So let's go to the other side. There we go.
One. We are
Easy.
down here. Starting on the temple. 3, 2, 1. Going a little bit.
And you feel it in the periphery where the breathing wasn't as dense, right? So when you put it on, of course, and occlude it, the freezing just into the hairline is not so, we call it dense freezing. So that's where I would kind of feel it in my hairline component the most. But other than that, no issues whatsoever. Voila. There we go.
Alright, and then I'm just going to change the grid size here for the lips.
For the lip.
For the lips. See how the lips?
Let me see if I can show you guys without. You see that texture on my skin there?
Oh, yeah.
Right?
Yeah.
Little white dots. So this is called the hyper technique that Alma, or the hyper mode that Alma has on the platform, which I love this hybrid platform because it offers so much. So you get a grid pattern, which is a grid that you follow. So like this. This is a completely randomized pattern that this delivers with. And so it's super, 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 super safe the way the energy is delivered. And then again, these little micro channels. So safe for the majority of skin types, I want to say. Now, again, if you want to add more energy for somebody like me that has melasma or somebody that has a darker skin type, you've got to be careful with the amount of energy. But you can put this really, really low. So I didn't put any freezing on my neck. I wasn't going to do my neck just because I want the proper, like, if I want neck, I want neck. But what I'll have her do is I'll have her put it down half the energy that she's using on my face right now on my neck where I have no freezing. And then even just going to do it on my hand so I can show you guys, I'll tell you what the level of pain is. So we always say to patients, there's a 1 to 3 level of discomfort. 1 is don't feel it at all. 2.1 is I feel it, I'm uncomfortable. 2.9 is I feel it, I'm uncomfortable, and you need to get this finished. Like I want to get off the bed. And 3 is forget it, I can't do it. And we want to listen to the skin. So I teach my providers, we listen to the skin when the skin tells us, even if it looks okay and the settings are okay, technically speaking, we listen to the skin because we don't underestimate the power of the inside-outside component. So our external skin is a reflection of our internal health a lot of the times, and well, all of the time. And when we have a lot of inflammation internally, when we start treating the skin actually will show us too much, can't handle this. So pretty awesome. Alrighty, Emma, here you go.
Just on the lips here.
Oh, and the nipples.
3, 2, 1. There's none in the middle.
It's more the anticipation of is it gonna get worse or.
I'm just gonna put some goggles on because I'm gonna do up by the nose and then closer towards the eyes.
Sounds great. Right. So again, this is the Alma hybrid machine, but it is the Pixel, which is very similar if you are on Instagram and you're kind of searching things to the Moxie treatment, which is a fractionated, I believe, erbium. This is CO2, right? So it gives you these little microscopic injury sites, which then will heal very lightly. Like it feels like sandpaper when it heats. You ready for me?
Yes. I'm just gonna get the nose here. 3, 2, 1. I could be by surprise.
It's great for fine lines and pores and, you know, again, absorption.
It's on the side here.
Right.
That's why I touched you. 3, 2, 1. I'll take these off so that you can talk to everybody. I'll get you to look up towards me and then I'll pull the skin off.
Again, so this is when you get closer to the eyes, it becomes more risky. And it's usually something that I do. So it's easy to show somebody to do something, but it's different if you've been doing it for years. So we're going to show you and leave my eyes open. But if we start again with this adding 15, 17 other vascular type of components, usually either put on intraocular shields or have a hand that really knows what they're doing, right? So just as a disclaimer. Okay, you ready?
Good.
You want to close or open?
If you look towards me, I can pull more at the same time. 3, 2, 1. Not so bad.
No. It's the anticipation, right, of that. Is it in or is it not? And I specifically didn't put a lot of freezing there because I wanted to kind of feel what it would feel like if you didn't do it without any. So very light. We'll put the photos.
I'm gonna do the upper.
Yeah, there's no freezing on the upper. I did that on purpose, right? So of course some of the freezing that's up here the product will absorb into the skin. But I tend to be brutal with the patients and say, yeah, you don't have freezing, then let's just bite through it. So I'm going to show you that I can bite through it too. Here we go. Okay. Came up.
Here we go. 3, 2, 1.
Yeah, it's not comfortable.
One pass.
Stand on the edge here. Here we go. Perfect. Well done. We'll drop the energy. We'll show you on the neck. What I'm feeling right now is that numbing but heat at the same time, right? You got it?
Yeah.
All right. I'll turn that way for you.
So what I'll do is 100 on the neck on each side.
Oh, sure. Here we go.
Here we are.
All right.
3, 2, 1. I'm gonna come up, but you twist her a little. This is
That's again, I mean, it's definitely not a joy. It's not something that you have the time to freeze for 20 minutes. I would probably freeze. In terms of being half the energy versus the face, I would say it's maybe slightly more intense than my face right now, which the face is frozen, right? Other than that, halfway there. Awesome. And that's kind of that. So we're going to be doing vamp now, right? Let me show you. This is vamp. So again, vitamins, amino acids, minerals, and PDRN, which is polydirobonucleic acid. And basically what that is peptides, right? So signaling proteins. So she's going to put that on. We're doing this as an alternative to PRP. I love PRP. This is a great option. And let's just talk about that for a second. So PRP, platelet-rich plasma, is how many platelets you have, how healthy you are, and so forth. So there's a variability that VAMP does not have. So see it like a skin booster or like a fertilizer, basically, for your skin. But this, we know exactly what we're putting in every single time. If you're healthy, though, I still think that the serum God put in our veins is the ultimate, is the golden serum. So, here we go. So it's going to go into those little micro channels. And when I was in Italy in the beginning of the year for the SCARS conference, one of the things that I learned there is this pressing the topical product into the channels we create. So it's especially helpful in scars, but anywhere where you're doing a laser-assisted delivery of medication and pressing it into the skin, you're actually helping the absorption. Of course, they did proper clinical trials to prove it. So that's what she's doing right now. Whereas before, we just put it on and it would soak in by itself. This is actually helping the absorption of the component. So VAMP can be done just like a PRP, can be done with microneedling. It's safe to be able to be put on the skin by itself. I probably wouldn't go that route. It's still not legal to inject PDRN in Canada underneath the skin. It is legal in the majority of the rest of the world. These are all just small little things that take time for regulatory bodies to respond to. Right now, I don't feel my face at all. My neck feels like a cold sunburn, like it's weird. So what I'll do every day is I'll just do a few photos and we'll do a video and put it on later. And I'll do photos of what the healing looks like. This necrotic debris, so that's mains, right? The mains that form these little micro, say, necrotic debris is dead debris, is basically the medical term for it. But these little micro injury zones, they're where the laser light went in, where the micro needling is a needle. This is a laser needle, right? It causes these what we call mains, and that's what you're seeing in the healing process afterwards. So again, it looks like sandpaper. I'm loving this fish.
really pushing it in.
Yes. The nice thing about laser being an energy-based device is that if you compare it to microneedling, which I love, by the way, microneedling is there's no coagulation of the blood vessels when you're treating. There's no heat, which makes it super safe, but there's a lot of bruising that comes with it. And so this will just look like, probably does already, looks like a light sunburn afterwards, whereas with microneedling, if you're going aggressively with it, meaning like 2 millimeters deep, the same as the laser is penetrating deeper for collagen stimulation, you will have bruising for a few days. And I call it like these little ecchymosis underneath the skin. It almost looks like a fine spray paint, like a purple spray paint underneath your skin. Whereas with this, again, I'll show you, I'll come a little bit closer. You can see it's just tiny little bit red and the vamp is on. Like really, you don't, it's almost for me that likes aggressive treatments. These treatments are like, kind of ramp it up. But it would be irresponsible of me knowing that I have melasma because I have not pre-treated my skin and it's summer, so we're not going to go that aggressive, even though that's what I want, right? Good. It's a lovely, lovely treatment to do for a light refresh. And again, if we have to compare it to something similar in the market, if you look at BBL and Moxie, right, which is a great, also there's great machines. It's not the alpha and omega Alma. I just love it for the customizable component of it. So if you're looking for something similar to that, that's the Dye VL and Pixel Peel component. Okay, so see you guys. Bye.